Wet age-related macular degeneration, or AMD, and diabetic macular edema, DME, are two leading causes of vision loss in the U.S. when left untreated. So ophthalmologist Dr. Suñer joins us to discuss a first-of-its-kind injectable eye treatment that was recently approved by the FDA. So we're glad to have you here, but first, tell us, what are the symptoms of wet AMD and DME?
Thank you, Jordan. It's actually very important because these are very serious blinding conditions, and the typical symptoms are sudden and progressive distortion of the vision, blind spots in the vision, or blurriness of the vision in one eye typically.
And so what are the current treatment options then for retinal diseases like these?
Right. So the current treatment or standard of care is injection of a medication. It's an anti-vascular endothelial growth factor, or VEGF medicine, that's given every 1 to 2 months to help prevent vision loss and to stabilize the vision.
And so let's talk about the new treatment then. How does this new option work?
So what's exciting is actually two different things. One is it works by the same pathway as a standard of care, but adds a second pathway, and I think the combination is very important. And it may potentially stabilize the vision and maintain vision with less frequent treatment. So it may go up to even every 4 months for these patients that were coming in every 1 or 2 months, potentially.
Let's talk about eye exams then. Why would you say eye exams are so important, even for people who aren't experiencing issues with their vision?
Right. Actually, that's extremely important because all diabetic patients need an eye exam, and everybody above age 60 needs an eye exam to check for these potentially blinding conditions, because they may begin without symptoms, and your ophthalmologist can pick those up early enough to help you, again, get better treatment and also monitoring to help prevent these blinding conditions.
Yes, it seems like anytime we do these medical related segments, it's all about prevention. So getting those screenings done, the annual checkups, and then maybe even more so if you do have issues. So where can we go though if we want to learn a little bit more information?
Well, of course, your best resource is your eye doctor for the examination and more information. There's also a lot of information available on vabysmo.com or VABYSMO.com to get more information about these conditions and the importance of screening for these conditions.
Wonderful. Well, thank you so much for helping us get the word out today.
Thank you, Jordan.
Of course. And if you'd like to see this segment again, just head to our website, firstcoastliving.net.